The significance of the sensory integrity findings shows an issue regarding the patient's lower extremities, the sensitivity and the discomfort that the patient has in the lower extremities. Interventions that will limit the patient being on his feet will be the course of action due to allodynia in the feet. We have to proceed with caution and check in constantly with the patient is something that should be done, especially in this case, just due to the pain and discomfort and the sensitivity issues that the patient has in the lower extremities. The functional reach test, that essentially is a test where the patient is just leaning forward with the feet in a fixed position, essentially hinging at the hips and just leaning forward just as much as possible without losing their balance. This test assesses patient's balance and forward motions to determine any impairments that need to be addressed. This patient, Andrew, his reach was 5 inches with normal being at 10 inches. The Berg Balance Scale, for this test, there are 14 different movements that are done for this test. And the purpose of this test is to determine the person's balance abilities while performing different tasks. Andrew's results were 41 out of 56, which is right at the cutoff for being a high-risk patient. The timed up and go, this test is conducted by a marker being placed 10 feet away from where the patient is initially going to stand up from, and they're essentially, like I said, just going to stand up from where they're sitting, walk up to that 10, walk up to that 10 foot marker, walk around it, come back down to where they were sitting, and they must conduct this test as quickly but also as safely as possible. We have to ensure that safety is the number one priority. And for this test, Andrew's results were 22 seconds, and normal is 10 seconds or less, which this shows that his mobility is impaired. Some of the interventions that we could do for Andrew involve straight leg raises, 3 sets of 10, with a minute rest in between each set. Rest when needed is crucial to let the patient know. We don't want the patient to proceed and continue when they are exhausted and out of breath. So for all the interventions, we're going to rest when needed. Progression will be we'll be adding an ankle weight for resistance for the single leg leg raise. Double leg stance on foam pad. This will be helping the patient with his balance. We're going to be holding for 4 minutes or 30-second holds for 3 sets with a minute rest in between. So sometimes the patient, depending on the patient, sometimes they'd rather hear the sets, which might seem less time or minutes. So it just depends, depending on the patient and depending on what they want to hear and what they're used to hearing. So progression will be to move to a single leg stance on a stable surface or continuing with double leg stance on a foam pad with eyes closed. And again, this is all depending on whether the patient has enough pain tolerance or if there's no pain, right? So we don't want to continue if there's no pain, if there's pain. Another intervention would be seated scapular retractions. So we're going to be doing 3 sets of 10 with a minute of rest in between each set. And these are going to be, like I said, seated. And a progression would be to do mid rows with starting with a yellow TheraBand, which is the lightest, and progressing to higher resistance on the TheraBand. And then another intervention would be long arc quad leg extension, 3 sets of 10 with a minute of rest in between each set. Progression will be to add an ankle weight or use cable machine, whichever is available, and whichever also feels more comfortable to the patient. Sit to stand, the last intervention, 3 sets of 10 with a minute of rest in between each set, or rest as needed. Progressing to a staggered stance. It will make this exercise a little difficult or more difficult, and a visual, and the progression will be when there are visual signs of the initial sit-to-stand being easy, or verbal cues as well. So if the patient is just letting you know that the exercise has become a little bit easier, and these will both help with improving lower extremity strength and the balance as well. As the patient progresses through therapeutic exercise, we will see if their pain improves and if their strength improves as well. So that's a way that we'll see if there's improvements within all the interventions and exercises that will be conducted for this patient, Andrew.